We have a real gem right here in Northeast Ohio. Metro Health is celebrating its 175th year serving the community of Cuyahoga County. Dr. Al Connors could talk about the hospital's amazing past, but today he's here to share how Metro is vital to the present and to the future of the community. Dr. Connors is the Chief Medical Officer at Metro Health. Welcome to the show.
Thank you, Lori.
We're very fortunate in our area of the country to have great hospitals. So what makes Metro Health special?
Well, we do have great hospitals in this community, and we're proud to be one of them. Metro Health is unique for the way it serves the community, the commitment of the faculty and the staff, and I think our mission and the desire to be available to everyone in the community, regardless of how you pay for your health care, is what sets us apart. It's a challenging mission, but one we're proud to serve.
Well, that's very important. And in fact, in talking about the reputation, you've had physicians both inside and outside the area who are very impressed with Metro.
Well, you know, Metro is, our faculty are very involved in their subspecialty organizations. They're active in their research. They're leaders in their field. So I sometimes say our reputation is even better nationally than it is locally. But Metro's an impressive place, and I think a lot of people haven't actually been there. And what I'll hear very frequently is people will come through the doors and they'll say, "Wow, this is a nice place," you know. And I'm thinking, well, yeah, it's a nice place.
What were you expecting?
Well, they weren't expecting, you know, the quality of a facility and I think the quality of care that we provide. So it's a pleasant surprise, but there are lots of people to whom it's not a secret, and they recognize the value of Metro.
We want to get that info out there.
Right.
So one way you're committed to the community is your plan of getting more involved throughout Cuyahoga County. So tell us about what the plans are.
Well, our mission is to be accessible to everyone, and it specifically says we're accessible to all, regardless of your ability to pay. And what we found in this economic downturn is we've seen a growth in the amount of uninsured care. People who've lost their jobs, lost their insurance, and come to Metro for their health care. We've seen a 36% increase in the number of people who come because they don't have insurance and they know they can come to Metro and get care. What's interesting is that increase has largely been out in the rim suburbs. That we've seen a bigger percentage increase there than in the city of Cleveland, where we more generally expected to see it. And we're realizing that we don't have the facilities and the availability out there. It's inconvenient for people to come. So we're trying to put sites out in the community so that everyone in the county is close to a Metro Health site.
So where's the next place?
Well, we're opening a place in Middleburg Heights, which is, we have a site down in Strongsville. We're going to consolidate this into a bigger site, with kind of broader coverage of both primary care and specialty care. We're pretty excited about it.
Okay, sounds like you are committed to the community.
Yes, ma'am.
And you mentioned that there's a lot of people who come who don't have insurance or other means to pay for the care. So how does all these services get paid for?
Well, it's a challenge. We pinch our pennies at Metro. But the thing that's wonderful about this community, and I think our county hospital, where in a lot of communities, the county hospitals require a substantial amount of support from the community. Places like Dallas or Chicago or Atlanta, where the price tag is in $300 and $400 million of support. At Metro, in Cleveland, we've always been able to attract a middle-class population so that we have quite a number of patients who have insurance, could go anywhere but come to Metro, in addition to the patients who come to us because they're uninsured. And we're able to provide services to them, make money in providing that care that offsets the cost of the uninsured care. So we right now get about $36 million in support from the county, and we're very grateful for that support. But we have about $130 million in costs of uninsured care that we have to cover each year.
Okay. Well, it sounds like you're doing a good job, and people really appreciate that. So that's great. Metro Health is a real treasure for us in Cuyahoga County. Great care for everyone, regardless of ability to pay. And Dr. Connors is a great example of the passion of the people of Metro Health. My thanks to Dr. Connors for joining us today.
Thank you, Lori.
To find out more about Metro Health, visit www.metrohealth.org. Next, how to move on.